Pregnancy with Dr. Nuela is a health organization committed to reducing maternal and neonatal mortality through education and, of course, access to healthcare. And our mission is to ensure that women have access to quality health.
Touch them in a special way. You know the aim. We want to see how this country can be free from abnormalities, especially concerning the newborn babies. As we'll be going to the table, you bless the food. Those that are still behind, you hasten their footsteps.
No, genetic disorders, sickle cell disease, diabetes, hypertension, mental disorders. Take the personal history now of the woman, including demography and age, education status. You know, the information they give a woman also depend on her level of education. Take the personal medical history. Look for all those infections that we'll see on our check list. Ask about vaccination status, behavioral aspects. All of this on from top pregnancy that will give to the couple, and the method is adapted for our local setting. Can use those things for pregnancy. So I think that is it. So to sharpen our memory, we'll have this question.
Anxious about having their first baby, they want to start.
That is good. But I don't go for hospital. And I don't do any lab tests. For check on yourself and your husband yourself, like when I don't do blood group, electrophoresis for sickle cell test, when I don't do check for STIs, STDs, sexually transmitted diseases, and HIV. Because you know saying that thing that too, when I don't do ecography for check on the tubes, you check on the.
When she was talking on the part of sickle cell, which is very common and very dangerous, she was just telling them that this is the condition and this is what they should do. But she did not like pick a life example and the consequences that. Yeah.
Yes.
I think on the last part of rounding up where she said, them when I not to marry, it's very dangerous because before they are coming to you, they have been in love. So maybe you can give them other options like if you really need children, we have possibilities of adoption and you can testing and screening so that they should make that decision. But at least they got the information, the children could pass, they could get sick.
No, we are still to come to that. That is.
Start explaining why each. You start with the supplement and diet, for example, so that you don't miss any aspect if you're following each step. So even you're telling them that they have to take folic acid, you're also encouraging them about their eating habits and the various things that they can eat to increase their folic acid. Then keeping a balanced diet, so you're talking to them about that. And with balanced diet, you're going now into your weight. So managing your weight, from there you had already checked maybe the BMI of your patient. Then you come now into the lifestyle. You do open-ended questions like, what do you think about smoking? What before you're getting pregnant? But once you get pregnant, you can go into the no weight bearing exercises. Then now, if this patient, if you see that she's 8 months, if you see intergestational age period, we're talking about in Cameroon, at least if you want to, you should advise after 1 year. If you see her coming at 8 months, when the baby is 8 months, you tell her that, okay, let's just wait a bit for 4 months. Why? So that you give now the importance of that intergestational period. Then during, maybe you say, okay, we're going to start now in 1 month. You start taking maybe your folic acid, you start doing your regular exercise within these 3 months. Then after that, you see that the baby is already 1 year, then you can take in that time. So you make sure that you don't miss any aspect. You come now into the vaccination. Have you taken the vaccines for these various things? Then you come into the health conditions. You must have checked now the blood pressure, you have checked the sugar, how is it, you can identify something new at that time, and you start giving follow-ups to see if it's being managed or not. But if they are already there, you start checking how far, how is it now, is it well managed? Then you encourage them to keep managing them very well. So you make sure that you don't miss diabetes, hypertension, HIV, epilepsy. Like we said, epilepsy, if they are on this medication, you have to change it now, and you tell them that please don't take in, for example, next month because of this. You can tell them, okay, take in the next 2 months. You do like that. Then sickle cell, if they are, you have to remove it now. Then maybe they can put you on your folic acid, or the ones that you might take in immediately. You can say that, okay, you start taking it now, and once you remove it, you can take in the next month. But you have already started your preconception care.
Or screen. You should be able to screen to identify some basic conditions. You ask the question, the person told you about their lifestyle, then you, the doctor, now you can classify. Okay, the person tells you about their alcohol consumption, then you can classify if it's excessive or not, and then you know what now to discuss with. The person tells you about their tobacco consumption, and then you can classify. From their baseline parameters, you know their body mass index, then you can know if they need a nutrition counseling. So those say yes, from their fertility needs, you know, and then you can know whether they need a counseling about fertility. So I think you should have a checklist, more like a screening checklist that is guided on the questions that you have to answer. This is good. If you look at it from the perspective of the items that we have to identify from that checklist, and then now you develop contents, and they should be evidence-based. You know that's why I stand around evidence-based. It should be evidence-based contents on what we are going to be discussing about, because there are so many things. For example, I can ask, you saw the challenge that the doctor had, counseling someone who seemingly the body mass index is okay, but there's a counseling for that. In terms of tobacco, how do we counsel somebody who is smoking? What are the components? All right, but let it start with the screening. Nutrition, deep dive into their nutritional habits, and then you know now what you are going to tell them in terms of what they need. Of the doctors. So thank you very much. I have been here for a while. I need to take my leave now to do some other things. I just want to encourage you that you should keep on with the good work, and to encourage Dr. Nuela. So when she started this, it started like a joke through social media that we used to see Top Pregnancy with Dr. Nuela. You see the way it is growing. Passion drives things, and it's an encouragement to each and every one of us to also do same. When you see problems happening in your community, try to think about things that you could do to improve on the life of the community. I'm sure she must have had a personal experience about preconception care, especially a gap, and she said, okay, what can I do? Let me bring this to the population, let us explain to everybody so that we can have better pregnancy outcomes. We can have people who are happy that they are pregnant. To solve the problems from the roots, and this is how you solve problems from the roots. So thank you very much, TP, Talk Pregnancy with Dr. Nuela. I'll be leaving now and report.
He went back there, and the husband called me back and said, Madam, the knowledge my wife got from Dr. Nuela, Dr. Mbako and you, and came back, I will not lie you that I'm going to come back as a teacher, and I'm going to tell other colleagues. So it boils down to counseling. It's the way that we take and talk to them.